Okay, hello everyone, we're live. Welcome to OKSA Connects. OKSA Connects is our virtual interview series. Our goal with OKSA Connects is to connect Oklahoma youth care professionals, foster parents, and other supportive adults with resources and knowledge on a variety of issues and topics that impact the lived experiences of Oklahoma youth in foster care. Our guests often include local service providers, subject matter experts, thought leaders, young innovators, and foster care advocates. And our participants always have the opportunity, if they're participating live, to ask questions of our guests and learn how to access or utilize the services that we talk about in our interview. OKSA Connects is funded by the Oklahoma Department of Human Services and coordinated by the University of Oklahoma's National Resource Center for Youth Services. I'm James McKenzie, and I work for OU. And my guest today is Kayla Branch. Hi, Kayla, how are you?
I'm doing well. What about you?
Doing great. Thank you so much. So one more little disclaimer before we get started. The views and opinions expressed by our guests are not necessarily the views and opinions of the National Resource Center for Youth Services or the Oklahoma Department of Human Services, but we want to hear them anyways. So Kayla Branch is a reporter with the Frontier, covering state government with an emphasis on the state's welfare system. We will be discussing today youth homelessness. Kayla knows a lot about that topic and kind of some of the challenges of reaching young Oklahomans and assisting them and kind of helping them go from being unhomed to finding a home and some of the services that kind of are going on. So just to start things off, I heard a couple of things, Kayla, that kind of stuck out to me. One was that kind of on a national level, and we're talking about foster youth, specifically youth in foster care, that 3 out of 10 homeless adults report having some sort of experiences with the foster care system. That's like 30%, right? And here in Oklahoma, that demographic seems to be the same. So when we kind of here at NRCOS, we collect those statistics about homelessness, that the rate among young people exiting the foster care system here in Oklahoma is right. And these are young people that are 19, about 30% of them report experiencing at some point in that transition homelessness. And then here in Tulsa, where our offices are, 10% of the homeless adults here in our city report having some sort of experiences in foster care. And something else that kind of stuck out to me when I was looking up kind of our topic today about youth homelessness is that there's a lot of kind of other things that occur that are associated with homelessness, such as young people in particular who are experiencing homelessness are more likely to get involved in the criminal justice system. They're more likely to have or experience kind of PTSD, more likely to have economic hardship throughout their life, not just simply when they're young. They are less likely to have high school diplomas or other types of higher education, and less likely to be earning living wages, right? So all these things are kind of associated or attributed to, or there's a relationship between them and homelessness. So help our viewers kind of understand a little bit more about kind of youth homelessness here in Oklahoma.
Yeah, so like you were just kind of explaining, it is and can be a really broad range of issues that, contribute to someone experiencing homelessness, and whether they're a youth or whether they're an adult. I think, one thing that I always hear from some of the service providers that I talk with is just, what causes homelessness on a very basic level is a lack of access to affordable housing. And so that's an issue for everyone. Is just, if you are experiencing homelessness, it's because you can't get into a home. And then, we can go from there about some of the reasons. But I think when you look at youth homelessness in particular, and then even more specific, youth that just recently got out of foster care, or folks that had, a foster care experience earlier in their lives, I think there's some kind of focus and specific reasons for why those folks can be at a greater risk of experiencing homelessness. when I was looking up some of the things that we were going to be talking about, I kind of focused in on this group of people that they call it aging out of foster care. So essentially, when you
Yes.
turn 18, you age out of the foster care system. So for some people, that can mean that you were in a group home, or maybe you were with a foster family, and on your 18th birthday, you could no longer stay there. And if you're at that kind of a cliff, it can be pretty clear how that could quickly lead to you experiencing homelessness. At 18, I think I still had a 6 months left of my senior year of high school. Wasn't even done with school yet. So I can't imagine, making that transition while trying to finish high school. Like you were mentioning with the living wage, if you don't have a GED or a high school diploma, it can be really difficult to get a job, immediately that can pay you enough to pay for a deposit on an apartment or a rental home, and then continue to pay rent and all your basic necessities. So I think that aging out cliff can be really impactful in foster youth eventually experiencing homelessness. But I think too that more broadly, when a child finds themselves, or a teenager or young adult finds themselves in the foster care system, I think it can kind of point to there are some background issues there that could lead to you having a lack of a stable and consistent support network. And yeah. I think that's something that a lot of us take for granted. Turning 18, graduating high school, and moving on to the rest of your life is something that's scary for everybody, but a lot of us have family and friends. We've been in the same place for most of our life, and we've got this, kind of, safety net behind us. And I think that people who are coming out of the foster care system in a lot of ways don't have that, especially if you have aged out of the system and you didn't achieve what they call permanency. So you weren't adopted, you didn't have a guardianship kind of put in place with, another adult. And that's not to say you don't have adults in your life that can provide that, but I think statistically you might be less likely to. And so I think all of that can really just contribute to making folks that, were in the foster care system at one point and more likely, or just at a greater risk of experiencing homelessness.
Yeah, and I like the way you said kind of that safety net's missing a little bit, and maybe missing is not the right word, but that safety net's a little bit harder to find, or a little bit more non-traditional or out of the box, right? And
yeah.
And sometimes, and it kind of depends on your experience, right? Whether or not you're coming from congregate care, which has rules about whether or not you can stay as an adult with folks who identify as minors, mm-hmm. or if you're not in a placement at the time that you happen to have turned 18, like you said, there's just kind of this magic number that occurs sometimes that can put you in a challenging situation. Another group of young people, and this sometimes intersects with young people in foster care, is unaccompanied youth who experience homelessness. Talk to us about what you know about that demographic of young people, and kind of their experiences as they're kind of trying to navigate these issues.
Yeah, so unaccompanied youth, it's when you look at reports or some of the different statistics on homelessness in a particular place or state, that's usually a group that's broken out and looked at very specifically. And I think that can point to a lot of people when they see like, oh, so you're 15 and you are experiencing homelessness, like we really want to address that. So there can be a lot of good information, and I've got some of that here for unaccompanied youth. I mean, in 2020 in Oklahoma City, 16% of folks that were experiencing homelessness were under the age of 25. And it's good that we have that data, but data for people that are, unaccompanied youth is really difficult to get, because these are individuals that have typically left their home or, wherever they're staying or were staying for, a specific reason. We hear a lot about youth that are in the LGBTQ community, and that they have left home maybe because they, were kicked out or were experiencing some other sort of issue for their identity. And so now they don't have anywhere to go. And so they end up, experiencing homelessness. I think too, there are folks that maybe experience, domestic violence situations or some sort of other type of abuse, and they have left home, or maybe it's just that they felt like their home, wasn't a safe, stable place to be, and so they ran away and they left. And so when you are a young person in that situation, I think we hear again, it's kind of typical that you have a distrust in the system, I say with quotes, or adults in general. And so, somebody comes traipsing around and asking you for all your information and to tell them where you're from and how you got here. I think that can be scary, that maybe I'm going to tell this person these things and I'll get sent back to this abusive situation or just a place where I really don't want to be. And so it can be really difficult to connect with those individuals because in a lot of cases they feel intimidated or scared, and so they don't want to be found. And so that can be really difficult to gather information for that group of people.
Yeah. And what sticks out to me about what you said is this idea of just, again, of intersectionality, right? And that already, if I have this lived experience of being in foster care, there's factors that kind of affect my risk of being homeless that we just talked about. But then when that intersects with being part of the queer community or being an unaccompanied minor or being a person of color or any marginalized community that we talk about, that the risk just goes up.
Right.
And you mentioned some of the reasons why that is, especially with like LGBTQIA young people, that there's a higher likelihood of kind of being not able to make connections with their family or not being able to make connections with the placement that they're in, where they feel included and safe. But what's interesting about what you said is this idea of like, also at the same time, not wanting to engage with the system or not wanting to, kind of reach out, right?
Yeah.
What do you think's kind of some of the drivers of that?
Well, I think there's that distrust, we kind of talked about too, with unaccompanied youth and that kind of specific experience. With foster care, folks who have been in foster care previously, I think too, what I've kind of heard is that, when you turn 18 and you're out of the system for the first time in, years, maybe you have some sort of control or say so about your own life. You're walking away from this state sponsored system that has, strict rules about where you can be and who you can be with, and you have to go here or there. And for the first time, you don't have any of that. And so thinking that, you're going to have to kind of give away some of your autonomy if you want to receive help, I think can be a deterrent and make it difficult for folks to want to engage. And I think too, when you've maybe had a bad experience in the foster care system, or if you're an unaccompanied youth, who maybe, you had told someone about the issues you were having, another trusted adult, a school teacher, and maybe nothing happened, you can, foster again, just that distrust that, what's the point if I bring this up? So I think there are a lot of factors that can go into why people are hesitant to, engage the system. And even though there are resources available, and like I said, whenever I think service providers see like, a young person that's experiencing homelessness or, is staying in a shelter or, doesn't have enough food to eat, it's very much like, oh my gosh, we're going to do everything we can to fix this. But there's a real and very valuable, portion that is like autonomy and getting to make your own decisions. And so I think that has to be factored into.
Yeah, I love that you said that. And that what I hear is like the time to intervene or start thinking about preventing youth homelessness is way before they're getting to that, as you called it, a cliff, right? It's building some of that trust maybe and stuff. For example, the Oklahoma Department of Human Services does offer voluntary care for young people, so to avoid that cliff, right? So that when you do turn 18, you don't have to be left hanging. You can extend your time in foster care until you're 21.
I will say though, that's only if you have a place to stay. You have to have a placement that would agree to take you. And hopefully you're in that spot where you're maybe with a foster care family and they're like 100%, stay. But maybe you aren't. So I don't know.
Right. So it really speaks to like beginning to think about these things,
Mhm.
when someone's 14 or 13 or 12, like what are we doing to create a space that feels like we can have conversations about what happens next? Well, I think that lays the groundwork for kind of what the issue is. But I think what's really important to me and probably to many of my viewers is like, so what do we do about it? So we have this high risk of homelessness. I would imagine most people hearing that information aren't happy with that statistic, right? That 3 in 10 young people who've experienced foster care could end up homeless. And so, what's some of those challenges in finding that home, right? Or thinking about what happens after you age out, or what those next steps are as you become an adult.
Yeah. Yeah. Well, we kind of went over some of it, but I'll just reiterate maybe in a little bit more detail. If you have turned 18 and you did that while you were in high school, and then maybe you transitioned to living in a shelter of some kind, or kind of, they call it transitional housing, which can be, I know in Oklahoma City, there's a space for men 18 to 23, and it's transitional housing. And it's essentially, a shelter with other folks that in that demographic. So if you're making that transition, it'd be really hard to finish school. And so, maybe you didn't finish high school, and now, you're trying to find odd jobs to do here or there. I think if you have had an experience of being homeless, that can be very traumatic. And so there's probably a lot of just underlying issues that you would want to address and kind of work through with someone who has had that kind of traumatic experience. And so I think all of that, you come to a person that has all of those factors going on, and it's like, okay, what can we do to help you? And I think a lot of times that can mean educational attainment, like, let's get you your GED. Let's find some, educational opportunities that work for you. Let's hook you up with a mental health care provider. Let's make sure that you have your physical health care needs met, whether that's some sort of medication, or maybe you had like an injury or an illness or something. Let's make sure that is all taken care of. And then too, with young people, there have been some really interesting ideas for non-traditional housing. And I'm thinking of specifically, it's essentially a village of tiny houses for youth in Oklahoma City. And, it's a tiny house. It's one person per house. And it's almost in this program where, you get in and you kind of learn money management, and they hook you up with employment, and you have kind of this case management aura around what's going on, but you also have that autonomy of, this is my space, this is my house, I'm managing, my finances or my schedule, my job. And so I think that that kind of really flexible and out of the box thinking about how we can better serve youth that have experienced homelessness or that are experiencing homelessness is really important, because what's going to work for a 20-year-old woman who spent 10 years in the foster care system and is now, food insecure and experiencing homelessness is going to be a little bit different than the kind of services that might work well for a 50-year-old man who is a veteran and experiencing homelessness for the last 15 years, so I think that difference is good to pay attention to.
I agree. And so on the one hand, it's having services that are directly targeted to this group of young folks under the age of 25 or so. And then the other thing that I heard was just what I'm hearing is that being homeless is part of having unmet needs, and that there's a lot more than just the not having a home as a need that's going unmet, right? There's a lot of needs that someone's trying to meet, and just trying to put myself in that position, right? And thinking about how do I get food? How do I get a home? How do I have somewhere to kind of handle getting clean so I can get a job interview, so I can get that job, so I can get that home? Or how do I take care of my medical needs? Like all that going on at the same time that I have this kind of younger brain, right? That's not fully developed yet. seems very complex.
Very complex. And I think even as, adults, folks older than 25, that kind of stuff can be overwhelming. It is.
Yes.
There's just a lot that's expected of you. And if you've had, a childhood and an upbringing that was maybe more chaotic than most other folks, and you've never had that stability, I think it can be even more overwhelming. So yeah, it's definitely a challenge, I think.
So to your knowledge, what are young people or young adults saying is needed for them to kind of overcome some of these challenges?
Yeah.
And when we're designing programs, is their voice kind of getting included in that, or is that happening?
Yeah, I think it is, and there's some specific examples I can point to. Like one I'm thinking of is this study that was done. It was a few years ago, but it was done in Oklahoma, and DHS, Department of Human Services, was part of it, and they did some surveys of teens. There were some from Tulsa, and they asked them, what was your experience like, and what would have been helpful for you, as you were going through the foster care system, and maybe as you aged out, what would have been useful for you. And some of the answers pretty consistently were saying, you just like access to information. I felt like nobody told me what was happening, or I didn't understand what was going on exactly. And so I just more information, more really clear information about what's available to me, what I need to be doing, what's happening. Like that would have been really helpful. And two, very basic, but places to live, like somewhere for me to live would be great. If there's a spot for, teens where it's like, okay, you just aged out of the foster care system. Great. We have got this apartment complex that you can come to for 6 months and figure out, what your next steps are. If you haven't already, had the opportunity to do that, or if you just need more time. Which is just such a basic answer. What would have helped me not experience homelessness? Well, having a house would have been great. So I think in some ways, like their voices are being included. And I think too, even if it's not in a survey like that example I just gave, like for providers, if you are trying to meet the needs of youth experiencing homelessness, you have to be paying attention to what they're saying, because again, like we've been talking about, they just like won't find you. They'll just keep doing their own thing. And so you really have to be being creative and be listening to the issues that they say they're having, and be paying attention to reach, this demographic. Though I was like, there's always more that you can do to make sure that people with lived experience are at the table, and that their voice and experience is, being included in solutions, because that's how the solutions are going to be impactful and effective.
Definitely. So you mentioned one program in Oklahoma City. I don't know if I caught the name of it, but they're creating like tiny homes as a solution.
Mm-hmm.
What other kinds of services are you aware of around the state for young people?
That
would be helpful.
There are quite a few, actually, and a lot of them have like state sponsorships. I'm thinking of like the Yes I Can program, which is a DHS program, the Oklahoma Successful Adulthood program, that offers a lot of kind of resources, connecting people to resources too. And I know the state will help pay for housing vouchers. They'll help pay, like, I think I saw, up to $2,500 they'll match you if you're buying a car. And you can stay on, Medicaid until you're at 26. They'll help you pay for college. They can help you pay for food. And like we mentioned just briefly, if you have a placement that will say yes, then the state can, help you stay in the foster care system until you maybe finish high school, or however long. So there are a lot of programs that are available.
Definitely, yeah. And so all of the Oklahoma Successful Adulthood stuff is funded by DHS, and it's kind of an example of DHS really working to kind of be creative about how do we solve this problem. Thanks to and that funding comes from a federal program called the Chafee Act that funds for a lot of that stuff. So I'm also aware of things like transitional living programs that a lot of the shelters provide, or maybe you had mentioned that there's this particular transition home for 18 to 23-year-old men, right? Are you familiar or aware of any other kind of living situations or services that people could go to out in the community?
Yeah. So there are several. I don't have a list of specific names of these different transitional living homes. Um, but let me pull some of this up. Um, I'm thinking of, in Oklahoma City, there is Sisu Youth Family Services. That's one, I believe, that runs that tiny home kind of village or location where people can go. There's also the Neighborhood Services Organization that runs some other kind of housing and transitional housing options. If you're looking to get connected to other resources, I'm sure that folks at the Foster Care and Adoptive Association of Oklahoma would be able to point you in some of these correct directions. I think more broadly too, some of the service providers that I'm most familiar with in Oklahoma City are like the Homeless Alliance. They're really great, and they have a team of case managers, social workers, and they're very well versed in the type of services that are available and how to get you connected to, like not just this is out there, go find it yourself, but like here's a phone number, here's a name, here's what they can or can't do for you. And so definitely if you're unsure of where to start, that is a great place that I would recommend.
Awesome. Well, let's switch gears just a little bit. So you cover the state legislator, and you're at the Capitol a lot. Have you heard any promising legislation or any kind of buzz around kind of addressing the homelessness issues here in Oklahoma from the legislative side of things?
Not so much specifically homelessness. I think that lawmakers recognize that homelessness is an issue in Oklahoma that people care about. And I think sometimes people are getting more vocal about, this being something that they want to address in their communities. And so it's kind of grabbing lawmakers' attention. But I haven't seen, this past session, I didn't see any bills specifically addressing homelessness or providing, additional funding to nonprofits that provide services to people experiencing homelessness. There really wasn't much in the way of that. And a lot of times it's been left more to cities or counties to use their general fund dollars to cover those types of programs, and there are a lot of federal grants that cover services for folks experiencing homelessness. And so I know that cities and counties will get connected that way. But up at the Capitol, it hasn't really been something that our lawmakers have looked at. I know that they've been looking at the issue of foster care more specifically. And in Oklahoma, the number of youth that are aging out of the foster care system at 18, that has definitely dropped. It's something that the state DHS has been looking at really closely and trying really hard to address. And those numbers they're going down for sure. And so I think though that still we see lawmakers. I was watching an interim study just the other day about how long it takes for a kid that's in foster care to achieve permanency. Because if you don't achieve permanency, I think you're much more likely to age out of the system. And you guaranteed if you don't achieve it, you will age out. But they talked about why it takes so long in Oklahoma for, folks to adopt a kid that's in foster care, or expanding the use of a legal guardianship. Like if you're a teenager that got into foster care at 15, maybe you don't want to be adopted, but you need a trusted adult to help you handle some of those legal things. That is another option that they're really pushing. And so they're trying to figure things out that way. But just broadly, how do we address homelessness in Oklahoma isn't really a topic that has come up that much.
Yeah. Or it's a topic where it's like, how can we kind of address things really way in the front end and be a little bit more preventative about it?
Yeah.
Are there other factors besides, obviously having some permanency, having a trusted adult in your life, or someone with some sort of means to kind of give you a space or support you is great. But are there other preventative things that people should think about when it comes to homelessness? Like how do we prevent folks from getting into this position in the first place?
Yeah, that is the big question. That's definitely the big question. I think can be such a huge question to ask too. Because there's so many factors that impact this, right? So like if you are experiencing mental health or physical health issues, that can be really difficult and it can be expensive. And so that kind of financial instability can lead you to having a trouble paying your bills. And then you might end up experiencing homelessness. So that, that's its own little category over here. If you have a substance abuse issue, that is another category that can put you at greater risk for homelessness. So I think, trying to really expand those types of services, make them much more accessible, and like Medicaid expansion, I think that is going to help a lot of folks get some of those underlying conditions or underlying issues taken care of, that can really make it where you feel more in control of your life. So I think that's one thing that the state is focusing on and is trying to do. Two, in Oklahoma, we've had some of the highest rates of incarceration. And if you have a felony conviction, it can be really hard to get approved for, some sort of housing anywhere. I don't even think that if you have a felony conviction, you can get, funding for housing from the government. So I think that's something too that Oklahoma is looking at, and that will be kind of helpful and have that trickle down effect. But like we mentioned at the beginning, experiencing homelessness is directly tied to a lack of access to affordable housing. And especially after the pandemic, something that's really interesting that I've heard some, social workers talking about is that, we hear all these stories about, oh, the housing market is booming. It's a great time to be selling your home and make so much money. We hear all those stories. And for these, social workers that are case managers that are trying to get housing for anyone that's experiencing homelessness, whether it's a youth or an adult or, family, it's been really difficult, because if you go to a renter or a landlord and you say, we have this family, we have, a housing voucher for them, so you'll definitely get your rent, can they move in? Will you accept them? And that landlord might say, I'd love to, but no, because I've got someone else who's offering me, $200,000 in cash to buy this home and flip it. And, it's like, well, so they're going to,
Right.
And so it's been really difficult for them to find places for folks to live. And I think, we don't know what the next 5 years is going to look like in Oklahoma's housing market, but we already know that Oklahoma has a really high rate, higher than the national average, of folks that are in low wage service jobs. I think a lot of our economy is made up of service industry, food industry, hospitality, a lot of jobs like that were definitely impacted by the pandemic, but also just generally 725, even working 40 hours a week. I think it's like $15,000 if you worked every single week of the year. And that is just not enough to live on or support a family on.
You can see the growing potential problem when incomes don't change very much, but the cost of housing continues to get higher and higher. So the cost of rent may have been 6 or 7 years ago on average, $800 or so for a three bedroom home, and now it's $1,200, and in the future it may be $1,500, but my income hasn't changed, and so that's a higher rent. That brings up a really good point, which is one piece of homelessness is not having that home, but another piece of homelessness is losing the home that you currently have. And I noticed that we recently, Oklahoma ranked 6th in the nation for evictions, and that there were 7,000, I think is what I heard, 7,000 eviction requests in 2020. And so more evictions could be coming, right? Are there services available for folks, or what can someone do if they're faced with a situation where they may be evicted that you're aware of?
Yeah. So it's such a sad deal. So Oklahoma like you mentioned, has a really high rate of evictions compared nationally. And I think part of that is because we have pretty lax laws providing protections to renters. So that I think is a big issue that people run into. Like, legally, what are my rights? One situation that I feel like I've seen a lot is I've got, mold in the air duct. So I haven't been paying rent to try to get my landlord to fix it, but then the landlord doesn't fix it, and then they give you an eviction notice for not paying your rent. And so you don't really have that many protections in that kind of a scenario. And if you don't have funding for a lawyer, then, your chances can be kind of shot. Though there is legal aid services of Oklahoma. If you are experiencing, financial instability, or you got an eviction notice, I would definitely recommend calling them. I would say, that right now, as you mentioned, with a lot of evictions being filed and coming down the pipeline, I know those folks have been extremely busy, and they've got booths set up in a lot of courthouses around Oklahoma. But I would just say keep calling, keep calling, keep calling. I've had some people reach out to me and say, I've called them and I didn't get a call back. Just keep calling, keep trying. There is money available right now to, pay off back rent if you have an eviction notice. So there is things that you can do right now that haven't always been there and been accessible, but because of COVID, there's money for it. You can also call 211. That is the state's just kind of general resource line. And if you, call 211, you tell them what's going on, they'll be able to connect you further with other resources. And the last thing I would say is that if you have an eviction notice and you have a court date set, you have to show up to court. If you, as the tenant, don't show up to court, it's an automatic default judgment for the landlord. So if you don't show up, you can't make the case for yourself, and the judge will automatically grant your eviction, and which can make it really difficult to get approved for other housing. So it's just, there's a lot going on, but I think the most important thing is that if you are worrying about eviction or you have an eviction notice, just show up, make those phone calls, and really advocate for yourself.
Great. Well, I hate to end interviews on a downer, right? And so my last question is more about kind of the future and optimism and kind of what from your situation as a reporter, what are you noticing as kind of some promising practices or some things that are kind of exciting you about kind of our efforts to kind of curb homelessness here in Oklahoma, or come up with, as you had mentioned, creative solutions? What are some things that you're excited about?
Yeah, well, I think it's exciting just how much people seem to care about this issue.
Yeah.
And just how much that it's getting talked about. That was something that really surprised me from when I first started really paying attention to and reporting on homelessness to now, is just the level of attention that these issues are getting. And with attention, especially in our government, usually comes financial resources. I think there's a lot of promise that something, can change for the better. I think too, there's a lot more stock being put in this idea of, they call it housing first, which is essentially that traditionally providers or the government has required that before somebody can get funding for an apartment or a house, they have to be sober, they have to have a job, they have to agree to participate in a mental health program, or, if a lot of this type of work is done by religious organizations. So maybe you have to agree to participate in religious ceremonies or services. And then we will give you housing or help you get housing. And
Right.
There's this new theory that's, I think it's not really new, but I mean, it's new to some people, and it's being newly accepted widely, is this idea of housing first. That, okay, it's going to be really difficult for you to go to work every day and attend all your doctor's appointments and stay sober if you are living under a bridge. That's going to be really difficult. And so before we require all that of you, we're going to give you somewhere safe to stay. And providers say that that's going to be way more effective. It's going to reduce the chance that somebody, has an encounter with the criminal justice system. And so that's something that I think is kind of, especially in Oklahoma and especially in Oklahoma City, is steering the ship in this new direction that, service providers feel really good about. And so I think that there's a lot to be excited for, and that folks are paying attention, and that currently, there are resources to kind of help stem the flow of folks that are maybe at great risk of experiencing homelessness, and to help those who are already there. So I am excited. I think there's going to be, a lot of good changes that happen in, even just the next 5 years.
Awesome. Well, thanks, Kayla, for sharing your thoughts and your reporting on all of this, and helping us stay informed on the issue. If folks wanted to continue following you and your reporting, where could they go to stay in touch with you and what you're doing?
Absolutely. So my Twitter page, I'm just at Kayla_Branch, KAYLA_BRANCH. And that's my Twitter handle. You can find my email there. You can find a link to readfrontier.org, which is where the website that I write for and the organization that I'm part of and where our reporting is. And me and another colleague, we also write about these types of issues, folks experiencing homelessness, the eviction crisis. So there's a lot of coverage there with more in-depth and detailed information. And if you shoot me an email or send me a Twitter DM or whatever it is, I'm more than happy to chat with folks further about anything you might have questions about.
Awesome. Thank you so much, Kayla. All right, so we're going to actually continue this conversation about homelessness with our next guest on October 11th. We'll talk with Andrew Delali. He is the project manager for the Homeless Youth and Runaway Services, which is part of the Oklahoma Department of Mental Health and Substance Abuse. And we're just going to keep this conversation about homelessness going. In the meantime, follow Kayla and her reporting, and we will be in touch with all of you next time. Thank you so much, Kayla, for joining us, and we hope to be in touch again in the future.
Thank you for having me. Great to be here.
All right. Thanks, everybody.